my name is Rachel Kless, and I am doing a presentation on emergency department injuries. I want you to be able to describe the efficacy of a nurse-mandated x-ray. So like, if a triage nurse orders the x-ray instead of a doctor ordering it, I want you to tell me why you would think it would be more effective. And I want you to tell me some situations where a nurse would be permitted to do this. Also, I have a question. What type of situations do you think nurses should be allowed to order x-rays? Should not, would be, but should.
In an emergent situation.
You think nurses should be allowed to do that?
I think that they can, and I think they could do it correctly if taught well, and use the evidence that we have available to us to be able to do that.
With an obvious injury present.
Yeah, I agree. Alright, so this is my PICO question. With emergency department patients with non-urgent extremity injuries, does obtaining x-rays prior to doctor assessment decrease length of stay as compared to those who see the doctor first? So you see them in triage, and then you get them in, and you get them an x-ray first. Does that, decrease the time? So this is the breakdown of the PICO question. Emergency department patients, getting the x-ray, seeing the doctor or not for the x-ray, and then decreasing the length of stay. This is where I got my information from, this EBSCO, and there were 132 different articles with the keywords nurse-initiated and x-ray, and they were all peer-reviewed within the last 6 years. And evidence is that Ordson, he found that with triage ordered nursing x-rays, it did decrease length of stay. And Rowe, he found that it was usually about 37 minutes that they cut off. So that's pretty substantial when you're trying to really decrease length of stay and have a high turnover. What else do you think could be done to decrease patient weight? Do you know any other kind of things that we could do to decrease length of stay?
There's, along the same lines, you could also labs.
Labs, patient
Obvious
order.
one, like throat cultures and urinalysis.
Yeah. So the goal is to decrease patient wait time and everything. Free, they found that a nurse who interpreted the x-rays actually had no false negatives, no false readings, and they did have some false positives, and that was about 3.7 to 13% of the time. So, it's not that bad, having a nurse read it. I would rather have someone say it's a positive than a negative, And then, so the current protocol here is that triage nurses are permitted to order x-rays on non-emergent patients. So it's going back to the objectives that we wanted to touch. And the result is that nurse-ordered x-rays have decreased patient wait time and improved patient experiences in the emergency department. And nurses are permitted to initiate x-rays for non-urgent extremity injuries. And it would be nice if we could order for emergent situations too, but no idea. And thank you all for coming. I appreciate it. Been good.
Great job.